What is up, guys? We are back again with another episode of the podcast, and today we are without Gary. So these are usually the better ones. People, I think, generally tend to enjoy when Gary's not here. He obviously, he just brings the mood down, he brings the vibe down. But we have replaced him with someone who actually knows what they're talking about in regards to all of this female health stuff. It is, our resident doctor, Dr. Nicola. How are you, Nicola?
I'm good. I'm good. Glad to be back on.
And we missed you for the last, like, I think it was like 2 weeks that you were off. You were sick. I think you were traveling one of the weeks. Like, it just wasn't great. But look, we're here. You're here now, and today we are talking about. Well, the last two episodes we've basically been talking about the in and around pregnancy sort of stuff, right? We're talking about nutrition, training, and we've kind of touched on this section a little bit. It's the postpartum section, or the like after pregnancy stuff. But we wanted to just keep it all in one episode. So even though we've covered some of the nutrition related stuff, we're going to do a little quick recap on that, just make a few notes. We won't go too in depth with that. We haven't really covered the training side of things in this kind of postpartum period. And I think that's where there are a lot more questions, right? And the reason for that is probably because, if you got through the pregnancy, you kind of probably have your nutrition somewhat dialed in. You kind of think like, okay, I've already prepared for pregnancy, or like before the pregnancy and during the pregnancy, I've been looking at the nutrition. I've been following the guidelines, because I think nowadays most people are aware that nutrition plays a role in, like, brain development for children, fetal development overall. And people are more aware of that. And people know, oh, I shouldn't be eating certain foods. Let me just look up what those foods are, right? And a lot of those things kind of extend into the postpartum period. And again, we'll touch on them now in a second. But with training, it's completely different. You might have started managing your training. You might have started understanding what to do with my training, throughout the pregnancy. Like, you listen to the last episode and you go, okay, there's a few different sections here. We might change this. We might think about this. But after the pregnancy, it's not like it just goes straight back to where you were before the pregnancy. It's not like, oh, well, I knew how to train before pregnancy, therefore I know how to train in the postpartum period. It's more like, okay, you just went through an event, potentially very traumatic event, and yeah, okay, cool, you get a child at the end of it, which is, great. We all love that. But it was still a traumatic, potentially, event for you, and we have to change how we approach training. However, there are also some, relatively poor, or there is also some relatively poor advice out there as well. So we kind of have to, you know, see what's what, and actually look into what makes sense, both from a theoretical standpoint and then actually, like, in the real world, what makes sense, right? So, Nicola, I suppose we'll just start with nutrition, and then we'll kick the topic off, with the training side of things. But where do we start with this, right? With the postpartum period, you just had the baby. Where should we start? What should we be thinking?
So like you're saying, for a lot of women, they were probably, if they're wondering about postpartum nutrition, they've probably been tracking their nutrition, pre-pregnancy, at least during pregnancy. So they already probably have a pretty good handle on it. I suppose one of the biggest things for postpartum is that you are still kind of recovering from this hugely, physically demanding event. You're still trying to provide for, another human if you're breastfeeding, and you're also probably a lot more active. You're kind of, picking a baby up. You're, probably wheeling them around, whatever people usually do with their babies postpartum. So there's a lot more energy expenditure, and particularly for women who are able to breastfeed. So, as opposed to kind of early on in pregnancy, where you're not seeing that kind of huge increase in calories, if you are someone who is breastfeeding, you are looking at having kind of 300 to 500 more calories per day, just to again provide that energy for the baby. So the same kind of rules apply. You're looking for nutrient dense foods. There are some other kind of specific considerations that you're looking for. You're looking for a bit of an increase in protein, generally around about kind of 11 grams extra per day, particularly around that kind of in and around kind of 6 months. It decreases a little bit after that for another 3 months. Again, not a huge difference. You're talking about like half a piece of salmon nearly, on top of that, you're looking for a little bit of an increase in your, kind of omega-3 requirement as well, like you were saying, for brain development. So that's kind of one of the main considerations, is particularly for breastfeeding women, for women that are recovering even from, C-sections. You are looking to facilitate that recovery. Secondly, as well, when you think about breastfeeding, kind of what we know is that um, babies that are exposed to a wide range of foods through their mothers, through breastfeeding, it can kind of develop their taste palettes kind of later on in life. So if the mother has more of a varied diet, it's more likely that baby then, when they grow up, will have that same kind of, again, it may be a different taste in the palate as well. So that is something else to consider. But I do think the recovery element is particularly important. And I know that we'll talk about later about, trying to kind of get your body back, or kind of, bounce back, and really that this period, the emphasis, not that it shouldn't be on trying to get your body back, but trying to take that stress away from women, and trying to focus on recovery, trying to focus on you, and trying to focus on the baby.
Yeah, like the way I always think of it is, we basically, as a human species, we basically go, oh, at 9 months, that's the time period of a pregnancy where we can still get the baby out, but that doesn't mean that the baby is fully developed. Like ideally, a pregnancy would probably be like 2 to 3 years. Like think about like an actual child. Like obviously, again, it's hard to think about it because we've evolved like this, but like an actual child's like brain development, etc. Like we'd ideally probably like to have a pregnancy for 2 to 3 years. Now I say we ideally like, obviously, look, all the previously pregnant women in here going 2 to 3 years pregnant.
Hell no.
We don't like that. But in terms of our actual like brain development, the development of the child and stuff, 2 to 3 years would be fantastic. So we're kind of in this time period where you need to be thinking beyond just, oh, I've had the pregnancy for the last 9 months. After that, it's not the child. Like you basically are still developing the child. And especially if you are breastfeeding, obviously, look, you are the sustenance for the child, So you need to be thinking like, oh, this is actually part of the pregnancy. Would I be dieting during pregnancy? For most people, no. Obviously, some people, they may need to do that, but most people are going to be on, okay, well, I actually need to ensure that I'm well nourished and I'm well fed during the pregnancy, because I'm effectively growing another human. But in the postpartum period, if you're breastfeeding especially, you are still growing another human. So while it is a very common thing to think like, oh, I need to get my pre-pregnancy body back and all that kind of stuff, it's not necessarily the most beneficial thing for the child. Now, of course, look, you have to weigh the I was going to say pros and cons, is not the right word, but weigh the situation out here and go, like, you might actually really dislike the way you look. You might be actually in a very poor position in terms of your own mental health, and you might have some sort of like postpartum depression on top of that. And getting your pre-pregnancy body back may actually be like an act of self-care. Now again, there's pathological ways that you can go down in that thinking and whatever, but again, we're not going to rule out, say, like, oh, fat loss, or thinking getting your pre-pregnancy body back is a completely off the table. It's a bad thing to be thinking. Don't ever think that. That's not the case, right? But for the vast majority of people, what we're really thinking, or at least if we're looking at the like research, we should be thinking we need to be well nourished. We need to make sure that we are well fueled, because even if you're not breastfeeding, you're still looking after the child. You still have to do all of the things around looking after the child. You might have a partner or a social support network that's able to take some of that burden, but realistically, and it's not just a societal thing, it's a human thing. Realistically, like, it's the mother that the child wants for at least the first 3 to 6 months after pregnancy. If you ever if you any sisters, aunts, whatever, that have children, like people in your close circle, your close family or whatever, that have children, like that child doesn't want to be held by other people. They might go, yeah, okay, like, yeah, like rock the child or whatever, grand, but they really just want their mother. That's all they want. So go on.
No, absolutely. And that's the thing, it's in no way, shameful to be wanting, weight loss, like, post pregnancy or anything like that. And there are situations where maybe it's appropriate, to be working towards that. Again, it completely depends on the individual, but it is important to highlight that there is kind of an overemphasis, and you see this in women's magazines. It's like how to, this celebrity's out for a run 2 weeks post baby, and look how they look. And sometimes that can be the narrative that plays out. So I suppose it's not feeling shameful if that's something that you're working towards, but not having the pressure on yourself. Because one thing that I like to think about it is that someone who's recovering from surgery, recovering from any kind of surgery, or anything in hospital, you're not kind of telling them to be on a calorie restricted diet or anything like that would be kind of an insane thing to do. Like if you think about Gary after his surgery, he was bringing in his protein shakes, and he was trying to optimize his recovery. But sometimes postpartum, like we were saying, kind of with C-sections, or someone has an episiotomy, that sort of thing, they can go straight towards, okay, the baby's gone now, so I need to lose this weight that I put on. But the same wouldn't apply for if you were to have any other kind of a surgery.
Yeah, and even if you don't think of it in terms of like a surgical thing, like if you were like an MMA athlete or something,
Yeah.
like I just had a fight, it's a traumatic experience for your body. You've literally experienced some trauma. You wouldn't just go in the post-fight period and go, you know what, actually, I'm just going to treat my body like crap here, and that's going to lead it to feeling better. That's going to lead it to, recovering quicker. No, you'd be like, okay, I actually need to respect the fact that I've been through a traumatic experience in terms of like a fight. I've been beaten up here, whatever. So I need to make sure that I'm feeding myself well. I'm not going to this like calorie restricted diet. I'm not doing any of these different things. And it's effectively somewhat similar with, pregnancy. Like your internal organs have been moved around, pushed around, or whatever. And like that's fine. Like it always freaks me out when you see like yeah, I mean it's fine in terms of a physiological thing, because like I always see it always freaks me out when like you see like surgery of like, well, you don't see it perhaps, but they cut open the abdomen, and then when they're putting stuff back, they basically just throw it back in, like the intestines are just like, yeah, just lash them back in there, and then they find their way back to where they should be. And so it's not like it's a huge oh my god, your organs and stuff have been pushed around. However, from a personal perspective, like you're probably going to feel that. You're probably going to feel your internal organs moving around, doing all different things. And again, you want to respect that your body has just gone through something for 9 months, and you want to make sure that you are respecting that after the fact and recovering from that. And usually we would never recommend, in 99% of the time, we would never recommend, oh yeah, for better recovery, you should be in a calorie deficit. No, like we don't recommend that. We'd be like, right, you need to be at calorie maintenance at the very least. And probably we want a little bit of extra calories in here, and it's the same when we're saying about like, oh, breastfeeding. Again, you need to be thinking, you're basically growing a child. You are the food source. So again, it can be somewhat incorrect thinking in terms of, oh, I'm eating for two, but you're basically growing that child. And you should almost consider it like if you were trying to build muscle or something. You're like, oh, I need to be in a calorie surplus. I need to be in about a 300 to 500 calorie surplus to build muscle. And that's effectively what that child needs as well. So
Yeah.
again, we need to be just thinking what's actually going on. Sorry, Con?
No, absolutely. And I think going back to the taste preference thing with breastfeeding, I think is, an incredibly interesting, kind of point in research. Unfortunately, not every woman is in a position where they can breastfeed. But
Well, like
that's,
we were saying I think it was the last one, like, or no, maybe it was 2 years ago, like myself and Gary, neither of us were breastfed,
yeah,
So it's like
yeah,
not always possible. Or again, especially in Ireland previously, like it was always, well, for the last like whatever, 30, 40 years before, like it was like, oh, like it wasn't the breast is best, which is now the current like kind of messaging, which can obviously be, taken to an extreme or whatever. But it was like, oh yeah, here's formula. This is better for your child.
yeah. There's incredibly low breastfeeding rates in Ireland, which is, I mean, insane. There's a plethora of benefits, I mean, that's quite, the taste preference is quite a small one in the grand scheme of things, and we're talking about kind of just health of the baby, nutrients, but also, if you're thinking about that kind of, postpartum body, it does help you kind of, lose some weight, does help you kind of, regain, your pre-pregnancy body, but there's a huge amount of benefits. But like I said, unfortunately, not every woman is in a position to breastfeed.
Yeah, and that's the thing as well. You have to, when you're having a conversation like this, you can't just be like, oh well, breast is best, and like we might think that from, again, a scientific perspective. But what do you do when you're like, well, I can't. The baby has a poor latch, or it's like
Yeah.
it's just not happening for me. My milk supply is just not sufficient for this child, or maybe you have triplets or something. I don't know. Like
Anything.
so
Yeah.
many things can come up. But as we were saying, it's like, right, well, if we have the option here, we're probably going to do some sort of breastfeeding. Like I ideally would like, in a perfect world, we'd be like, right, everyone can breastfeed for at least the first 3 to 6 months. That would be fantastic. Like in some other cultures, they're like, yeah, up to 2 years. That seems a bit, for me, I'm like, if you see a toddler at 2 years, like still breastfeeding, I'd be like, that's a bit weird. But maybe that's just what we've done in our society, our culture. It's like, that's a bit weird, some Victorian era ideals of like, nudity outside or whatever. I don't know. But either way, we're like, okay, for this first 6 months, that would be fantastic if we could breastfeed. But again, it's not always possible, right? Is there anything else on our list here to just recap on, breastfeeding? Well, we should probably just further go into just what you were saying about the different food selection. Like, yeah,
Yeah.
it's great for the child in terms of, oh yeah, look, you get these different foods. Potentially, that's going to lead to a better, or a wider palate enjoyment for them. They might enjoy different foods or whatever, which obviously makes, like, if anyone who has had children or interacted with children, that like feeding can be quite hard. They're like, oh, I don't like this. They just want basically like chicken nuggets and chips or something like that. So if you want to make your life easier, eating a variety of foods when you're breastfeeding could potentially do that, because they've basically been exposed to some of these. Now, again, it's not like this is like the most conclusive, most fantastic research, but there's some evidence there to suggest that. And again, if we're thinking about it, forgetting about the potential benefits there, if we're thinking about it from the mother's perspective, like, you want to get more nutrients in. Now, again, that can be excessive, but you want to get a wide variety of foods in so that you're enjoying the diet, but also so that you are getting a wide variety of nutrients in, because you've just been through a traumatic experience. You've been through an experience that required a lot of your body. Like, again, you just grew a human. And so you want to replenish some of those nutrients. You want to, especially if we're thinking, okay, maybe I want to have another child in, like, I know in Ireland, like, they'll often have children like Irish twins, where they have a child like a year later. But like, it's like, if we're having children again in the very near future, like in my family, like, we're basically all 2 years apart. So if you're thinking about that, you want to be going, okay, I need to make sure that I'm prepared for the next pregnancy. And that's something that you kind of need to start in the postpartum period, especially if you are going to have children relatively close together, because this happens quite frequently in this day and age, especially not like, a year, not like, Irish twins or whatever. But if they're having them like every 2 years, like, that's actually, in the grand scheme of things, a very short time frame. And this does happen a lot in this day and age, because, women these days will be having children and they'll be like 32 or something, and they're thinking like, look, in the next few years, I might not be able to have more children, and I want to have, I don't know, well, let's just say 3 children. If you're 32, you're kind of going, okay, well, every 2 years, assuming that, it's like, at the end of that, you're kind of going, I might be actually like 38 or something here, and I might not actually be able to. So we have to be thinking about that stuff. We just have to make sure that we're putting ourselves in the best position to be able to have those children in the future. But also, we want to support those pregnancies. We want to make sure that we're giving the nutrients to the child. So we want to be thinking in that postpartum period initially, okay, how do I actually just refuel? How do I make sure I replenish all of the food, or it's way bad way of thinking about it, but all the nutrients that I've lost. Now, of course, a lot of these are water soluble. It's not like you can store them for long term, but some of the things, you do have an increased requirement for them. So from your own health perspective, we want to focus on just a nutrient dense diet in general. But then again, some of them are fat soluble, some of them can be stored for later term or later use. So we do want to be focusing on that nutrient dense diet. And again, if it helps the child, it helps you down the line where your child is like, yeah, well, actually, I like all these different foods. Happy days. It's a win-win. And then there are just a few other things that we did touch on in terms of like caffeine intake if you're breastfeeding and stuff. Like that's, unfortunately, it's not something that we can be going, oh yeah, I just have like 600 milligrams of caffeine. Like it's still being transferred to the child. Same with alcohol to an extent. And that's, again, it's not to say like, oh, I can never drink alcohol or whatever. Like I know some people do that where they time their alcohol, where they're like, oh, I'm gonna like
Yeah.
breast milk, and then I'm gonna basically like put it in the fridge or whatever, and then I'm gonna have my alcohol, so it's out of my system by the next time I'm breastfeeding or whatever. Like, so there are ways around that, but again, it is one of those things where you just have to do a bit of planning, because if you do drink alcohol, that's going to your child if you're breastfeeding. Is there anything else on the breastfeeding side of things that you want to bring up?
I
Because,
think I think that covers most of it. Yeah.
cool. And then I think we covered all on the nutrition side of things that I didn't necessarily want to cover, because again, we covered it before. Again,
Yeah.
talking about the fat loss stuff, because that is the thing that people really do focus on. We're just basically making sure that we're supporting the body. We're not thinking, I need to get my pre-pregnancy body back. Again, that can be a thought process. That could be a helpful thought process for some people, but for the vast majority of people, we're just thinking, okay, I want to support my body. I want to, nourish my body. Like it's going to, quote unquote, bounce back to some degree, even without intervention. Like you're going to have, like, basically, again, you've just grown this human. Your abdomen is going to shrink over time. Like it is somewhat elastic, I suppose you would say. It's going to shrink over time without you doing much. So you don't have to be thinking like, oh, I'm 1 week postpartum, look at my tummy, it's all, it's kind of saggy or whatever. It's like, yeah, like that's completely normal. Like it's basically like a deflated balloon here, because you just had a child. It's going to go back to the way it was, in no time, right? So anyway, let's move on to training after pregnancy, because I think this is where people have a lot more questions, because again, as we said, they've probably been managing their nutrition beforehand. They have a somewhat of an idea of this, but the training side of things, they might have been managing everything, but now it's all changed. They're like, okay, well, do I just go back to the exercises I was doing before pregnancy? I don't have this, bump to worry about. Can I go back to doing like hip thrusts, or like, they have questions like, when should they go back? Again, we were just talking about, you basically had this like traumatic experience. Again, for some people it might be more or less, but either way, you've still had trauma to some degree, because you've had this pregnancy for 9 months, you've been carrying the baby around, you've been doing all the stuff. Do we just go straight back in? Do we just go, right, I just popped out that baby 3 days ago, let's go back in the gym, back doing my deadlifts, back doing my squats, doing whatever? What's the story there?
Yeah, so the thing is with training after pregnancy, the guidelines and the advice is pretty terrible, and it's really hard to navigate for a lot of women. And the thing is, it's really looking at, where you were kind of pre-pregnancy, where you were during pregnancy, and where you kind of want to go with training afterwards. So just say it's going to be very different for a woman who has never trained before, someone who was, kind of in the gym 5 days a week before pregnancy. Maybe they weren't at all during pregnancy and want to get back into it after, or someone who was active before pregnancy, active during it, and, had a pretty, unstressful pregnancy as well. So it really kind of depends kind of where they are currently, and where they're coming from, their training level. So there is this kind of 6 weeks myth, that a lot of women, we're told kind of after 6 weeks you should be cleared to start kind of training again. But again, it's really about kind of assessing kind of where the woman is. So was it something that that, they might have had an extremely kind of stressful, physical like birth. There might have been, a fractured tailbone. There might have been some kind of tearing, kind of damaged muscles, nerves, tissues, etc. You're looking at kind of what age the woman is, their training age beforehand, how many babies they've had, the type of birth that it was, whether it's a C-section or a vaginal birth. That's going to have, completely different impact on how they return to training afterwards. Do they have any symptoms of pelvic floor dysfunction? Etc. So you really need to kind of take all of these different things, into account. But before we even kind of get into that for a woman who was already training, and as someone who's just kind of looking to get back into it, even for a woman who hasn't trained before, maybe they weren't a very doing much physical activity before pregnancy, during pregnancy, and there still are a number of benefits to even kind of starting kind of a low level kind of physical activity, postpartum, whether that's kind of improved mood, kind of well-being. It can be a hugely stressful time for a lot of women, and we know that the rates of postpartum depression are huge. And having some kind of physical activity, can be a really good, adjunct to other therapies. So you're looking at improved mood, well-being, kind of blood pressure, cardiovascular improvements, your bone mineral density, improve. A lot of women will experience kind of back pain, kind of low back pain, kind of pelvic pain. Kind of small amounts of physical activity can improve those sorts of symptoms. Particularly women who might have had gestational diabetes, exercise can improve blood sugar, and that can, help kind of prevent the progression onto type 2 diabetes later in life. Then you're looking at improved kind of sleep quality, duration, which is the same for the general population as well. So there are, a number of benefits for physical activity, not just for a woman who is already training. So just as an aside, just to mention that.
And also on that as well, like I know people often think, oh, I'm going to use this exercise to like, again, get the pre-pregnancy body back, get all that kind of, I want to tone up or whatever. But we don't want to just view exercise from that perspective. We're not just using it as a tool to change our, aesthetics, I suppose you would call it, the look of our body. We're using it as a tool to promote health, right? So because this can kind of play on some people's minds where it's like they'll either do one of two ways. They'll either go, oh, I'm going to go all in, I'm going to really try to change my body, I'm unhappy with the way it looks now after the pregnancy, I'm going to go all in, I'm doing like, bodybuilding, whatever, right? And then you have other people that kind of go into it with the perspective of, well, I'm not really trying to change my body at the moment because I'm just like respecting, I just had pregnancy, still dealing with the child, blah, blah, blah. So I'm just not going to go to the gym because, I'm not actively trying to change my body at the moment, and both of them are probably, not great perspectives. We just want to use exercise as a tool to promote overall health. And again, we've talked about the health benefits of exercise ad nauseum on the podcast. So it's not like, if you listen to the podcast at all, that we're big proponents of exercise for the myriad of health benefits. But, it is one of those things where this is a relatively simple intervention you can do to get a huge, huge amount of benefits. Now, obviously, the hard thing with pregnancy and postpartum period, and just in general when you have kids, is there are a lot more potential barriers to actually getting exercise in, For example, like if you're like a single mother, for example, and you don't really have a huge social support network, you could just be like, right, well, I can't spend an hour in the gym. I can't go to the gym 3, 4, 5 days per week because who's going to mind the child or the children, And that obviously is a huge barrier. And this is why we're not so fixed on the actual modality in terms of like, oh, you must be in the gym, you must do whatever. We just want to encourage exercise, movement in general. Like you can get a phenomenal workout at home. Now you might not have the overall time to do that because that is obviously one of the limiting factors in terms of, we all have 24 hours in a day, but that doesn't mean that we all have the same 24 hours, so you might not have the time. There are going to be potential barriers to actually getting exercise fitting it into your week. However, it does have a huge amount of health benefits, especially again, if we're talking about there is this huge, we'll call it information transfer if you're breastfeeding to the child And, that's exercise plays into that, right? But also in terms of your overall health, your overall ability to be the, I'm going to say, best mother you can. Like, as I always say to people, I'm like, you're probably not your best self if you're hungry, like you're probably not your best self if you're not exercising as well. Like, you're just, unfortunately not. Like, humans were designed to eat a certain way, and we're designed to exercise. We're like, movement came before thought, right? It's like, you should be moving in some degree. Again, doesn't have to be, this, oh, this is the ideal way of human movement or whatever. Like, I'm talking, you could go for a few walks,
Yeah.
that you can get some activity in. We just want to encourage the body to move, to actually, do the thing that it was kind of designed to do.
Yeah, absolutely. And it's one of those things where, yeah, it's just looking at kind of where you're at, and kind of where you want to go. And I know probably for a lot of women who listen to the podcast, they're probably people who are, really into their training. Like, just say for myself, if I suppose whenever I have kids, kind of going from going to the gym, focusing on strength training a couple times a week, to having to step back from that, is something that's going to be difficult. And so particularly for women that are kind of training a lot, it can be a huge life change, and having to, it's about not trying to jump back into that, so too quickly. So there is kind of, a framework kind of laid out. And like I said, the guidelines are generally terrible, but there are kind of a number of things to consider, and that's kind of a whole systems approach, kind of taking kind of biopsychosocial model, and then there's a number of things that we need to consider. So like we were saying, so any kind of childbirth related trauma, whether that's, kind of abdominal wall dysfunction, pelvic floor dysfunction, and post-traumatic stress, and those kind of things, I think we're going to go into a little bit deeper later. But those are things that you need to consider. So someone, who has pelvic floor dysfunction versus doesn't, they're going to have a different kind of return to exercise, than each other's. Someone with mental health difficulties, like you're thinking about kind of breast health, someone who's breastfeeding, if there's any issues there, energy balance as well, as someone kind of, under eating, for the amount that they're expending, kind of with the baby, with breastfeeding, etc. You're looking at psychological well-being, like we said, kind of both postpartum depression is huge, baby blues, etc. Fear of movement is another big thing with a lot of women as well. They might be having that kind of, kind of pelvic or lumbosacral pain, and just, again, movement might just be something that they kind of don't want to go near kind of at the minute. And then obviously sleep disturbance is a huge one, for new mothers as well. So there is kind of a rough framework called kind of the 6 R's. So that's kind of to guide the return to exercise kind of postpartum. And so the first one, the first R is kind of ready. So kind of early kind of postpartum. And that's trying to maintain some kind of exercise kind of throughout pregnancy, obviously where it's kind of safe to do so. And that's just trying to kind of optimize the postpartum recovery. So again, that's for people that were in a position to maintain some sort of activity level kind of during pregnancy. So that's kind of the first kind of, six weeks or so. And then after that, you've kind of hit that 6 weeks mark where people think that it's, grand to exercise. That's generally kind of the guideline. But here it's when you really need to kind of review and kind of evaluate the woman. So if there's any musculoskeletal concerns, like we were saying, any of the abdominal wall issues, pelvic floor dysfunction, kind of any rehabilitation needs, in that regard, or anything else we were saying, we we're talking about the sleep, the fear of movement, the psychological well-being. So here, even though it's a point where people are deemed kind of safe to return to exercise, if someone's experiencing, kind of urinary fecal incontinence, on running, on any kind of movement, again, this is the point where you kind of need to stop, take stock, and say, okay, where do we need to go in here? So that's checking in with a pelvic health physio, checking in with a kind of GP, another practitioner, and not just saying, okay, I'm at my 6-week mark, I'm going to go for a 5K run. So a lot of people will kind of, ignore a lot of these issues and say, no, I should be able to return to exercise. But actually it's about kind of screening, for all these different symptoms. So after that, you're looking for kind of more of like a kind of a graded exposure kind of. So the third, or then restore. for about kind of 8 to 16 weeks. So again, kind of a graded exposure to going back to training, and returning to a more of a, a structured training program. And again, that's also dependent on symptoms. Like a lot of women may remain kind of asymptomatic, up until that point, and that's when they might be experiencing kind of pelvic floor dysfunction, or whatever. Then the next, or kind of reconditioning, kind of 16 plus weeks, and again, maybe that's adding in kind of more load into the training, and then kind of more specific training, whether that's kind of strength training, and whether that's kind of more training towards kind of long distance kind of running, and then after that kind of return. So again, just kind of bringing up the ante of the training, and then refine, so bringing in kind of the whole kind of return to kind of full level training. But again, that is completely dependent on the woman, and there are a number of issues that we can run into. So like we were saying, if there's anything that you want to add to that, Patty, actually.
No, I literally just think of it as like that first 6 to 8 weeks, you're just kind of generally moving around. We're just generally thinking, okay, we're going to respect the body. Then after that, you're doing some sort of, we'll call it like general physical preparedness. It's not like overly specific. We're just doing some maybe cardiovascular work. We're doing some, maybe some resistance training, but it's not like, oh, I'm going to go into this, big like bodybuilding program or this new CrossFit program or whatever. It's just like, I'm just going to generally move. I'm not really trying to push progressions on anything. I'm just, getting the body moving. I'm enjoying myself. There's no pressure to, oh, I need to be doing X, Y, and Z. It's just general physical preparedness, like if you think of it like, like if you're a sporting athlete, it's like, okay, well, there's a period of time where, yeah, you want to stay fit. You want to just, keep the body ticking over, but it's not really the preseason. It's not like, oh, I'm not preparing before the season starts or whatever. It's just, okay, I have 6 weeks off here or whatever. Like, I'm just keeping the body going. I'm just keeping things ticking over. That's kind of what we're thinking here. We're just getting back into exercise in a more, slightly more vigorous way than maybe we were doing in the last, like, whatever, 3 months of pregnancy. So I'm just enjoying training, just getting the body moving, nothing too much. And then after that, we can slowly start ramping things up in a more specific way towards the actual individual's goals, and then also towards, whatever needs to be done, whatever needs to be addressed.
Yeah, exactly. So like I said, like really kind of, kind of screening for those kind of like we are saying, pelvic floor dysfunction. There's a lot of, kind of questionnaires online. There are apps that can help out. Ideally, people would have, like every woman should have, a pelvic health physio kind of, postpartum. I know particularly in Ireland, there's not everyone has access to that for kind of a number of reasons. There's really not that many of them, and obviously it's something you'd have to pay for as well.
Yeah, I don't know why that's not part of, like in Ireland we have all the, like, oh, here's all the, like, yes, you do your 6 week check and you do all these different checks for the baby and everything and whatever. I'm like, why is this not even just a consultation, maybe in the 6 week mark or whatever. It's like, surely there's enough people, I don't think it's on the NHS as well. I don't think they do that either, but I'm like, this is just such an issue, first of all, but it's also such a thing that it's like, this could actually be like treated, like, well, not everything, but like, these things we can, like, right, there's a lot of stuff that we can do. And if you get a pelvic floor examination, you have a pelvic floor specialist to talk to, a lot of these issues can be prevented. Like, you see people, I know, like, women or whatever that, have had pregnancy and they're like, oh, like I still get like some incontinence or whatever. And they're like, you're like 3 years post pregnancy. It's like, there's stuff that we can do here. It might not like fix everything completely, whatever, but we can be working on things, so yeah, I don't know why it's not part of the process.
I don't know about the UK, but it's definitely not here. And like I said, there's just not enough of them. Like, I'm down the hospital here in Waterford, and I was talking to a woman about this, and I was like, have you considered a pelvic health physio? And she's like, there is none in Waterford. It's like, it doesn't exist. And again, it's just a pity hearing kind of a woman in their 40s that doesn't have access to that, and more so because this is so common in a lot of women that they kind of think that it's normal, but just because it's common. It doesn't mean that it's normal. And it was the biggest issue as well, that I have that. And a lot of women decide not to do anything about it, which is their right, and that's fine. And they're fine with a little bit of maybe, incontinence every now and again. But it's for the women who, it's a barrier for them to do a lot of things. And I think that's kind of the biggest issue with it, that it'll stop participation once again, kind of in the gym, in training, which is what I find kind of the biggest issue with. And a lot of women as well, like I'd say if you were to, do a survey, and a lot of women my age probably don't know what the pelvic floor is, we all hear about maybe like Kegel exercises, but no one really, it's just not something that is kind of common knowledge. Again, it's one of those things that's kind of taboo where it shouldn't be.
Don't talk about that. No.
Yeah, again, it's just something, oh yeah, like because everyone, over the age of 50 is getting, incontinence or whatever, that it's normal, and it's not. So that's one of the biggest things. But there's, I suppose, if you are self-screening for a lot of these things, like we're talking about graded exposure, but there, like I said, there are apps, there are kind of, things that you can use. So whether it's doing, kind of a 30-second run test or fast walk test, whether it's kind of hopping on one leg, for kind of 10 reps, and there are ways that you can kind of screen yourself. It's obviously not ideal, but there are, like I said, there is information out there that you can use for that, instead of being like, okay, I'll just go for like a 10-minute run now and see what happens. Take things slow and kind of be easy on yourself.
100%. So what issues potentially are we looking at in the postpartum period? Like obviously we just touched on a good bit of like, pelvic floor dysfunction. We might touch on some more, but what other things are we looking at? Because this is probably one of the bigger barriers, right? If you're just going, oh, I had a completely lovely pregnancy, perfectly like fine postpartum period, I just got back into exercise, I just did it, there was no issues. Like obviously that's not everyone. A lot of people have specific issues either throughout the pregnancy, perhaps again like they maybe had like a C-section or something, or there's specific issues that they're dealing with through the whole pregnancy postpartum period, and that's preventing them from exercising, or perhaps needs a more like specific approach to deal with. But what are we actually looking at? What are common like musculoskeletal issues that can occur in this kind of postpartum period?
Yeah, sure. Look, let's get the pelvic floor out of the way. Let's just keep going. So I suppose I should actually explain kind of what the pelvic floor is. So it's made up of a connection of kind of muscles and connective tissue, I should say, and it forms sort of like a sling or a hammock across the base of the pelvis. And I suppose what kind of keeps all your kind of like the vagina, the urethra, all the kind of pelvic floor kind of organs kind of in place, and it supports them. So it'll help prevent things like kind of urinary incontinence, fecal incontinence, kind of help stabilize kind of the pelvis, the spine, and it supports I suppose the baby kind of during childbirth as well. So it there's a lot of kind of risk factors for why there might be pelvic floor dysfunction. Again, like we're talking about age, we're talking about childbirth, we're talking about the amount of children someone has had. If there's been kind of twins, triplets, you're kind of more at risk of pelvic floor dysfunction as well. If someone's had an equipment assisted, birth, if there is a delivery with forceps, whether there was like a vaginal tear or episiotomy, whether there was a fracture. Some women can unfortunately fracture their pelvis during childbirth.
It sounds incredibly painful.
Which sounds just dreadful, to be honest. So incontinence is one of the big things. And again, you're looking at either kind of a pelvic health physio, pelvic floor training, and even kind of lifestyle modifications. So whether that's your like water intake, that sort of thing, making sure you're not kind of more having little and often rather than kind of loading yourself with water throughout the day. Then you're looking at, kind of modifying exercises, modifying programming. Again, with all of these different issues, we could get into the nitty gritty here of how you would modify exercises, but again, it'd be incredibly boring. And it's just something that, again, is just, based on the individual. But there's lots of ways that you can modify exercises and programming to help either kind of lessen the symptoms, or so just that they don't happen while you're exercising as well. So pelvic pain is another issue, and particularly during kind of if a woman's had like a C-section. So you'll find kind of bending, kind of lifting, all of that sort of thing may be painful. And again, that scar has to heal to a certain amount before someone can even get back into training. They might have other kind of bladder pain from a UTI, or if there was a catheter inserted kind of during the C-section. Pelvic organ prolapse is another kind of a big one that can happen in up to 80% of women. They might be asymptomatic from it, and it might self-resolve. But that happens when, the kind of connective tissue that we were talking about that kind of supports the internal organs, when that kind of support is kind of insufficient, and those organs can kind of descend into the pelvis. Again, you're looking at kind of exercise modifications. You're looking at kind of, breathing exercises, making sure a woman's not kind of bearing down too much or just holding their breath through exercises. You're trying to avoid kind of high impact, heavy loaded, that sort of thing. Again, it's all kind of individual based.
Yeah, we were saying I think it was the last one where you're doing that kind of Valsalva maneuver. We don't want to be in that like extreme Valsalva where we're like and like really intense. It's like that. We kind of want to avoid that. You still obviously do need to brace. Like we're not saying like, oh yeah, just go in completely like a noodle. Like that's not what we're saying either. It's like we do need to brace, but we're trying to avoid that like extreme brace, that extreme like I'm trying to like fill my abdomen, if you will.
Exactly. So it's just about modifying it. And again, just kind of relearning that breath. I mean, if there's one thing that you're doing kind of in the recovery period when you haven't really gotten back into exercise yet, is just trying to connect to your breath, kind of in a way, again, that you're not just like holding your breath and kind of bearing down, increasing that intra-abdominal pressure. So that's one of those kind of, small things that's actually going to make one of the biggest difference kind of in the end. So, talking about kind of the C-section in particular, like we said, there needs to be a certain amount of time kind of for that scar to heal. But what we forget as well is that this is like a major abdominal surgery. Like you're cutting through muscle, you're cutting through fascia, you're kind of removing the bladder, like sort of putting stuff back in, you're taking a baby out. It takes a while to recover from this sort of thing. There can be a lot of pain, obviously reduced mobility. I mean, it's a disaster if that scar gets an infection. So again, thinking about that kind of breath connection, thinking about gentle exercises. And what we say is, even exercises where you're kind of just gently kind of moving, your arms above your head, kind of lengthening out the legs. And again, just trying to actually desensitize that area kind of, around the scar, so that it's not as painful when you kind of fully return to exercise as well. So gradually kind of strengthening that area, again, kind of monitoring for symptoms as well is important. And what you'll find as well with a lot of women that have had a C-section, you might find that their posture is a little bit worse. Again, if you think about it, you have this big scar across your abdomen, you might find yourself you're hunched over a little bit more, maybe from breastfeeding, maybe from walking. So again, maybe focusing on some kind of postural exercises. And again,
You can see that a lot as well, because you see people, first of all, during the pregnancy, maybe they had a big bump, so they're in this very like anteriorly tilted like pelvic position. Then maybe they have a C-section and they're kind of like, oh, I'm kind of crunched over, and maybe they're also carrying the baby on one side, so their hip is pushed out to one side because that's what everyone does, And it's like all of these things, like they're not issues. Like the human body is meant to move in a million and one different ways. But if we're just constantly doing it in one way, like we potentially run into issues as a result of just doing it that one way. So again, you might want to do some like postural exercises. You might want to do even just like, okay, well, let's actually sit in a normal position here for a while so we can even just strengthen some of those muscles in a seated position. It doesn't have to be like I'm in the gym and I'm working on whatever, you know?
Absolutely. So, and that's the thing, and a lot of these things, like, the next I'm going to talk about is like kind of neck and upper back pain. And again, you're looking at kind of, postural advice, you're looking at kind of strengthening, stretching exercises, kind of joint mobilization. And again, like neck and upper back pain can be a lot linked in with stress. And I know when we're going through a lot of this stuff, it can seem really soft. And you're like, here, I was lifting, 150 kg in the gym, and now you're telling me about postural exercises. But it is kind of one of those things that, you will get back to that, but you need to have these smaller things in place as well, that like if you're really advanced in the gym, but you've completely forgotten about, the small stuff like your breath, like, the fact that your shoulders are up to your ears the whole time, it's you're going to find it harder to get back to that point. So kind of, don't think you're too good for the smaller things, because though these kind of smaller changes again will kind of snowball into bigger ones, and will put you in a better position to get stronger faster. So
And like there is no like perfect posture, because I know whenever people are like,
absolutely.
you should be doing this like stand up straight with your shoulders back type of thing, and it's like like there's probably better or worse postures. However, that's just, we're talking to a general population here, right? We're just talking, there's better or worse postures to be in, right? But if we're talking about an issue that has been brought about because of a known thing that we've done, whether it's again due to the pregnancy, whether it's due to again the postpartum, maybe you had again C-section, maybe whatever, you're holding the baby, whatever. Like if we know that there's a thing that's causing this, and now we have pain as a result of this, and we can't get rid of maybe the thing that's causing it. Like you're not going to go, oh, sorry, not carrying the baby anymore, or sorry, I wish I could just not get the C-section, or whatever it is. Like we still have to then come in with potentially postural correction exercises, I suppose you'd call them. But even just having an awareness of, oh, well, this is probably a better posture to be in. This is the posture that I was in like pre-pregnancy. Like when we're talking about getting our pre-pregnancy body back, it's like, oh, this is what we should really be talking about. Like, let's get the function back that we used to have, so we're no longer in pain. But I do want to just reiterate that there is no perfect posture. So don't be like, oh, I have to be doing this, whatever. I should be sitting like this and I should be standing like that. Like, yeah, you want to be comfortable. But if we are experiencing pain as a result of the way our body is moving currently, then we're going to have to come up with new strategies for our overall posture, which usually involves some sort of postural correction. And I'm not talking about like, manual manipulations or anything, but I'm talking about like, we actually need to strengthen the body. We need to effectively, quote unquote, relearn how to do, this posture.
Yeah, absolutely. And that's what I mean when I say postural advice isn't like, walk around kind of with your back straight, but I definitely be someone, if I'm a little bit stressed, my shoulders are up to my ears for about 24 hours. So it's kind of just about kind of tuning into your body. And even if it's kind of taking kind of 5 minutes out for just kind of, again, just moving your body, kind of joint mobilization, just to kind of, again, just kind of break that bit of a stress cycle from your body, just not staying, again, kind of hunched over for too long. But yeah, that's so kind of neck, upper back pain. And again, these are things to just think about, like if a client's, returning to exercise as well, it's that, sometimes we can think like, let's just kind of get them back into training kind of quickly. But these are kind of smaller things that they might be suffering kind of a lot with. So neck and upper back pain, is a big one. Again, you're going from, not holding anything to maybe holding a baby. So again, that'll tie in there. Again, kind of lumbopelvic pain is another big one. And kind of up to 50% of women might kind of experience that kind of low back, kind of pelvic girdle pain. And again, like we were saying, that's from, you're now kind of picking up a kid, you're running around after them, you're kind of, moving around the house a lot more. It can also be more of a kind of a psychological thing. Definitely, and even kind of like sleep deprivation might kind of play into this as well. So I think kind of this is kind of multifactorial and will kind of resolve for a lot of women, but a lot of them will have this kind of chronic pain. And again, you're just looking at kind of increasing kind of, muscle strength, function, looking at, kind of strengthening exercises for the lower limb, for the back, and as well, focusing on, kind of stress relieving strategies as well. And just trying to, kind of, I suppose, help them kind of get over this huge kind of stressful event that's happened in their lives.
100%.
Doesn't have to be huge and stressful, but anyway.
In general, there's going to be some degree of stress involved. There's going to be some degree and this is why I said, like, I'm like, there's a variety of things that can go wrong. That doesn't mean that things will go wrong. It doesn't mean like for everyone that they're going to experience all of these things. I'm sure there is one unlucky fucker out there that got everything on the list.
Exactly. And but that's the thing to notice. Some women absolutely fly through pregnancy. I mean, if you were to ask my mom, she's like, barely even knew, it's fine. It just completely depends. But I suppose the highlighting these things is more so just for the women who are suffering with this and maybe need to kind of hear, like, actually, yeah, no, I'm kind of not alone.
Yeah.
So
I always
it's not all doom. It's definitely not all doom and gloom.
Yeah, like I always troll my sister, like she has like 7 or 8 kids, and I'm always saying to her, I'm like, yeah, but you're literally designed to do this. It should be easy. And she's like, there's so many things that go wrong. It just triggers her so much. And I literally do it to trigger her because I don't actually believe that. I'm like, it should be it's fucking easy. It should be just like, going to the toilet. Like, it's like you're designed to do this, But yes, look,
here for,
but anyway, is there any other issues that potentially could occur, or we have to think about, at least when we're talking about like a return to exercise, or whatever?
Yeah, so actually one of the kind of the biggest things is like it's called like diastasis recti, which is essentially it's a really like normal part of pregnancy, but it's where like your linea alba, it kind of stretches to accommodate that kind of growing baby or that growing fetus. So your abdominal muscles essentially like separate, and it can cause this bulging, and that's where you hear that kind of like like mummy tummy or whatever, which I'm saying in inverted commas because it's kind of a bit demeaning, but it's where they kind of widen and stretch, and you can kind of see this kind of doming, and so there's an increased distance, I suppose, kind of between kind of the rectus muscles, and that's where you'll kind of see this gap, so that there is a huge focus on that, and it's really common in I think most women kind of will get that, but it will recover, so it will just kind of naturally kind of shrink back together or in closer together, but a lot recover quickly, but up to kind of 50% can still have some separation, or still have kind of quite mild or significant separation, up to kind of 6 months after, and it's one of those things that it's not only we focus on the aesthetic kind of portion of it, but it also means that there's a huge reduced kind of function kind of the abdominal muscle. If you weaker abdominal muscles, maybe you're kind of having more back pain, again you're still carrying around a baby, but we do focus a lot on the aesthetic aspect of it, and it can be a huge issue for a lot of women, because particularly when you kind of have that bulging, it can actually make you still look like you're a little bit pregnant again, which can be worrying for a lot of women. Again, it's something that, like, ideally you'd be seeing a pelvic health physiotherapist for, but kind of things that you want to do to help, I suppose, with to kind of shrink that back in. You're looking at trying not to kind of overstrain the abdominal muscles, so things that will cause kind of that kind of doming or bulging, so you're trying not to do kind of huge amounts of you're not trying to kind of overstimulate those muscles too quickly, so that's getting back into kind of heavy exercises too quickly, or a lot of kind of abdominal exercises like crunches, like raises. So it is kind of watching out for that kind of bulging of the muscles. You want to be looking at kind of starting with kind of low level exercise, and again this is relevant for the majority of women coming back into exercise. So I'm looking at lower level exercises that are kind of well supported, whether they're kind of in machines, kind of seated, and then kind of working your way up to kind of maybe more supine exercises, body weight exercises, obviously if you're symptom free.
Yeah, and again, this is one of those things where, like, I wish you could just go to a personal trainer and go, oh yeah, like I have this issue, let's sort this out. But realistically, most personal trainers are not going to be able to go, oh, okay, yeah, okay, they might be able to understand how to modify exercises around it, or maybe potentially even help you with just the return to exercise. But in an ideal situation, we would go to some sort of physiotherapist for this, some sort of person that actually is qualified in dealing with, the postpartum period, but as we've discussed, unfortunately, there's not always that available. So it is one of those things that, if you do have issues, like, it is important to bring it up with your, healthcare providers, whether it's your doctor, nurses, whatever it is, because they might have resources that they can be like, okay, well, this is what the NHS or the HSE or whatever says for this, and maybe not on the diastasis recti, but it is one of those things where you kind of have to be your best advocate or your own advocate and go, okay, well, I'm having this issue, even if it is an aesthetic issue, you're just like, I'm just not really as happy with the way my abs are looking at the moment. What can be done? You might have to do your own research on this, and again, that's an unfortunate thing, because there's a lot of crap information out there, and you're going to be exposed to, God knows what. But it is one of those things that if you can find some good resources, or you can ideally find someone to actually guide you through this, it is something that can be, rectified to some degree. Now, some people are just going to always have some sort of splitting, I suppose you would say, of the abs. It's just always going to be something that's there. Like, there's like bodybuilders, like male bodybuilders, that have it to some degree, that you can see it. But it doesn't mean that it's a huge issue for them. It doesn't mean that, oh, they're now experiencing, like, we'll call it abdominal dysfunction. They might have the visuals of it, but they've strengthened their abs in such a way that they're not experiencing any, we'll call it, negative side effects to it. But anyway, is there anything else? Because look, we've covered a lot in this episode, and as you said, like, we could go do a deep dive on any one of these specific like issues that we've brought up, and realistically in future we probably will have some resources on our website and stuff where it's like, right, this is what we do in terms of this. But right now, is there anything else that we should be thinking in this kind of postpartum period where you'd be like, okay, this is something to think about with training or even nutrition? Is there anything else that you want to bring up?
So I suppose, like we were saying, like, the big thing is there, we've just kind of hit the, the main points of things that could happen. And there are, like, trainers that are qualified in, kind of postpartum, and you can go into all of these in a lot more detail, and give a lot more kind of recommendations. Ideally, someone would see a pelvic health physio, but there are people that can help. It's not just like, hey, here's a load of issues that you might have. Like, there are a little bit more kind of specific guidelines, but it is, I suppose, just kind of put them out there. But we would be here all day if we went through specific guidelines for each kind of thing.
And look, we very well might do that in future.
You very well might. We very well could. But for today, it's just kind of, a general kind of overview of things that, if you're a trainer, even to look out for kind of with a client, without going into the specifics of each, exercise that you could potentially do with someone with these issues.
100%.
I think that kind of covers most of it anyway.
Yeah, fantastic. Anyway, look, I'm going to wrap up the podcast here, because look, we could go in depth on some of these. We could do a little bit more on them, but I'd rather, save that for future. But I do want people to come away from this episode and think that it's not just, oh, there's all these issues, I'm going to have all these barriers to exercise, or all these things I need to be thinking about with nutrition and in this postpartum period. Like, we didn't even cover any of it. Like, we mentioned it in terms of like the biopsychosocial stuff, but we didn't cover any of the things related to that. But there are all these barriers, or I should say, there could be all of these barriers to exercise or to good nutrition. And that's unfortunately just the case. It doesn't mean that you're a bad person or whatever if you can't exercise, or, oh, I'm doing my body a disservice, or I'm doing my child a disservice, or whatever. If you can't get fantastic, perfect nutrition, you can't get to the gym, you can't do whatever. Like, the key with all of this stuff is to just try. It's just to try, do your best, whatever that actually looks like for you as an individual. Like, yeah, there are things that are, we'll call them better or worse. Like, I'm not going to advocate like, oh, you're addicted to, I don't know, meth or something. Be like, oh, just try, not do it while you're breastfeeding. It's like, ideally we're not doing that. So there are some things where we're like, okay, trying is probably not good enough. We need to just do. But for the vast majority of this stuff, like, it is a case of, look, just do your best. It's not like humans have been giving birth for thousands of years. So it's not like this is an incredibly like astronomical task to do. It is something that requires a little bit of attention. It is something that requires a little bit of like planning and foresight, but it doesn't mean, it doesn't mean that this can't be done. You know, it is something that has been done. Like you are here because it has been done, you know. However, that doesn't mean that you as a specific individual, or, you know, if you're a coach coaching people, it doesn't mean that the person in front of you hasn't experienced or won't experience specific issues. Now, those specific issues might require specific interventions or specific protocols or whatever. And that's kind of what this episode was about. It's just like, okay, there are things that can come up. You should be aware of them. There are potentially specific interventions that we can do for them. However, you may not be qualified to do them if you're a personal trainer, for example, right? If you are an individual looking for information, again, you run the gamut of terrible to, you know, this is good to, you know, this is still bad, you know? So it can be hard to find good information. And again, this is why I would just suggest talking to your healthcare providers. And yeah, okay, you're probably going to need to do some of your own research. You might be like, oh, actually, they mentioned X, Y, or Z in this episode. And that's actually something that I've been dealing with. I didn't know that that was something that we could potentially work on, right? So again, we're not saying that, you know, pregnancy or, you know, post-pregnancy is going to be hard or easy. It's going to be different for everyone, unfortunately, you know. Well, I suppose fortunately. And then also overcoming any of the issues that are potential barriers to you exercising or nutrition. That's going to look different for everyone. Like again, like you just had a child. Like we're just talking about the physiological or the physical stuff. Like again, you just had a child. Like we have to think about who's going to mind the child if you're going to go train, or who's going to help you with the shopping, or like anything like that. You know, it's like there are a huge amount of barriers that we're just effectively ignoring right here, because obviously, again, this podcast could go on for 20 hours if we were to cover every single minute detail, which again, we very may, can't even speak now, we very well might do that in the future, right? But anyway, unless you have anything else to conclude with, Nicola, I'm going to wrap it up.
Nope, sounds good.
Fantastic. Anyway, guys, you know where to find us. There, you can literally look at the, you know, description box above, below, wherever it is on wherever you're watching this or listening to this, and you can find the links to all of our services. You know, we do offer coaching. Nicola, you are a female health expert, and so if people do have issues, like, you know, they can talk to you, Nicola. You can set up a consultation. You can talk through this stuff with you. But also you do offer coaching as well. So it's like, right, if you have this issue and you think, okay, this is something that I want to work on, you know, Nicola is there to help. That's why she's on the team, you know. But we do have coaching spots available for other things as well, you know, whether it's, you know, body composition, strength, you know, injury rehab. Like we have a very multifaceted team, you know. So if you have issues, whether it's just even you want to work on your nutrition, like we have nutritionists that can help, you know. So all of that stuff, again, we have people on the team that can potentially help with the issues you have. The only way you can find that out is either you go to our website, look at all their different things that they have going on, or, you know, just get in contact. You know, we are you know, normal humans. Like we don't bite. We can talk. We're like, oh, actually, we don't help with this issue, but I know someone that potentially does help with this issue, and then we can just refer you on, you know. Other than that, the best place to find us is Instagram. This is where we do a lot of free content, a lot of content just aimed at helping people understand, you know, various topics, or just have a better idea of how to navigate the health and fitness world, because it can be, you know, quite crazy out there, and we ideally hope to put out great information. So if you want great information, go to Instagram, follow Triage Method, and you should find it. Other than that, you can subscribe to the podcast on whatever podcast app you're listening to, or on YouTube or whatever. That really does help the growth of our business, and it really does make us record more of these episodes, because we know, okay, people are actually listening to this stuff. You know, if you do have the ability to like, share, subscribe, do all of those different things, do it. You know, that would be sound. If you did enjoy this stuff and you're like, all right, actually, I know someone that would benefit from this, like just send them the link to the podcast, whether it's the YouTube or, you know, Spotify or whatever it is. Again, that stuff does really help. Anyway, guys, I have nothing really else to add to that. So we will see you in the next one.